You're listening to the Toe Talks podcast. Today, we bring awareness to the atrocities that hospitalized patients endured during the scam-demic, the inhumane practices, egos, discrimination, and medical failures that were perpetrated on patients by the medical community itself. We will spotlight how healthcare professionals stopped critically thinking, stopped practicing evidence-based medicine, and stopped allowing for bodily autonomy. Hospital administrators told physicians how to practice medicine while holding their jobs as leverage, and exchanged the health of human beings for governmental, pharmaceutical, blood money. Stick around. You're not going to want to miss it. We are the rugged, authentic savvy, and you're in the right place. Live free, pursue health. Powerful living starts in 3, 2, 1.
They have basically kidnapped him. I nearly got arrested.
So this is how they get them in the hospital. And then they get them to get admitted. And then they kill them. Need some prayer. It's getting real fast.
Welcome to episode 8 of the Toe Talks podcast. I'm your host, Dr. Toe. You're in for a very special episode. What you are about to hear is a very raw and very personal story about the COVID hospital ovens. We must tell our stories, and the world must never forget them. But we won't stop there. We'll chat about the good that can be found in the evil, and the important takeaways that can be gleaned from the events that unfolded in the fall of 2021. Today, I'm very excited because today is the first day that Dr. Toe Talks podcast will have a guest in the room, the first interview ever, and they are a very special guest because they happen to be my husband of 23 years.
Aww.
So, everybody, this is Lee. Lee, this is everybody.
Excited to be here.
Today, we're going to be talking about our personal stories here, specifically our COVID hospital ovens nightmare story, which happened in 2021. But before we get into that story, we're going to time warp back to 2020 and give you a little background information that will play a role in this story in making it more significant and serious. So in 2020, Lee was diagnosed with chronic lymphocytic leukemia. Right after that diagnosis, the doctor said, "We're not going to do anything." Can you explain to our listeners why that is?
Well, basically, what they do with CLL tends to be waiting on symptoms or markers.
Yeah, so they're basically looking for a certain level of symptoms in order to begin treatment, but research says that early treatment doesn't make a difference. However, Lee and I would tell you differently. We would tell you, start fighting. Yes, you can start early treatment. That can take many different forms. Change your diet, start exercising, get good sleep, cut out as much stress out of your life as possible. Start eating lean and green. Buy organic as much as possible. Eat foods as they come out of the ground. Juice, take supplements. So many things that you can be doing. So when they say there's no early treatment, do not buy into that, especially when it comes to blood cancer. But there is another option that you won't find anywhere else because it's personal to Lee and I. I've done past episodes that you can go listen to on the Toe Talks podcast, or you can go to my website, drtoe.com, and look at the protocol itself that I put together. And within the protocol, I did some pre-research, which is a case report on Lee. It has graphed data with his blood tests comparing what we did before the treatment and after the treatment. It also works synergistically with oral chemotherapy. we're going to start talking about our story here, but I wanted to preface the story and just let you know that Lee and I have talked a little bit at length about what we were going to discuss, but not all the entire details, just to keep it more authentic. And the other thing that you'll be hearing that will be mixed in between this interview are real voice text recordings from me speaking mainly to one of my really good friends who does not live here, and my mom, who at the time did not live here either, just updating them on the events that were unfolding at the time. All right, so this first portion is called Getting COVID. We're going to fast forward from 2020 to 2021, and specifically the very end of September 2021. Lee and I and our two kids went to Greenville to visit his family there and celebrate his mom's birthday the Monday before we left. So this is the last Monday in September. Lee began to experience a chronic nagging cough, but didn't feel bad, didn't have a temperature, and we couldn't figure out what was going on. And at this point in time, his lymph nodes were really swollen in his neck, and his symptoms for CLL were beginning to progress. So by Wednesday, we decided we were going to give him something to treat for allergies, because we thought, well, he's not having sick symptoms. But since his CLL was progressing and his lymph nodes in his neck were fairly large, we thought, I don't know if this is CLL related or allergy related. We left for Greenville on Thursday. That night, he had pain sleeping on one side of his neck because I can only assume because the lymph nodes were so swollen. And then he woke up in the morning on Friday. It's funny because Lee and I talked about this. I said, Lee, do you remember waking up on Friday morning, trying to eat a banana and crying because it hurt so bad to swallow?
Yeah, I did not remember that. I guess I wanted to forget.
Yeah, it was such a bad time. He was in a world of hurt. So because of that, we called his oncologist. And then later that evening, do you remember, I think we talked about this, you don't remember when we discovered that you probably had COVID? Do you remember where we were?
I thought we were at the apartment because I just told you that I couldn't taste anything.
Yeah, we were actually at the mall eating Chinese food.
Oh, that's right. That's right. Yeah.
Okay, so it was my son, my daughter. Lee was sitting across from me. We sat down with our food, and we all began to eat. And he looked up at me, and he goes, I can't taste my food. And I was like, oh.
We knew something was up.
No, I don't think I ate my food after that. Oh, no. And then our son began to say, I don't know that I feel so good. I don't know what's going on, but it could be the big C.
The surprising thing that I think back at during that time is, COVID happened in 2020, and for a year and a half, I didn't get sick, even though my immune system was down, which was really surprising. So this caught me off guard.
Yes, and I will say that because his immune system was so vulnerable, I researched a lot and put together a guide. This is the things that we need to do to try to prevent sickness. This is what we do when he is sick to get healthy and shorten the duration. And naturally, as time wore on, more and more people began to ask me for this very same information. And so I finally decided to put it in an ebook form. And if you're interested in it, you can also get it for free at my website. I'll leave the link in the show notes below. So I do think that was helpful in maintaining Lee's health in the long run. But honestly, I have to give a lot of credit to Lee himself because he did an incredible job of cleaning up his diet and eating lean and green, cutting out meats and processed foods and sugars so well, doing lots of juicing. He was a superstar. And I do believe that your immunity starts in your gut. And I think that was one of the crucial tools in our tool belt that helped to keep him healthy. Because while supplementation is very important, eating healthy is crucial. Otherwise, you're not getting the most out of your supplementation. Your supplementation is really just the icing on the cake. The cake is eating right. So I think that's what helped all of us actually. But I also think that COVID wasn't as contagious as we thought it was, because on that trip, Lee came down with the Delta virus variant of COVID. Our son got it, and we left on Sunday, and by Monday, I knew I was sick. But yet my daughter, who had COVID a month prior, who was sleeping in the same room with my son, who was in the same car, 5-hour trip twice with us, didn't get it. Why is that? What do you think, Lee? What's the answer to that? Why did she get sick, Lee? Natural immunity is king.
Oh, yeah.
Yeah. So, and I'll add as a sidebar that when my daughter got sick, we did nothing different. We didn't quarantine her. We treated it as if it was any other virus, and none of us got sick. And both my daughter and my son, when they got this virus, had no problem with it. It was like a mild head cold for them. On the other hand, it was a different story for Lee and I. But point being, not as contagious as they said it was. As a matter of fact, Lee's mom and dad, who were in their 90s, did not get it. No problems. But, when we get this virus, I would describe it as a very bad flu. My hair hurt, my scalp hurt. We had night sweats. There was this major fatigue and headache. It was kind of like the flu on steroids. It wasn't horrible as, people were making this thing out to be in general. I'm not saying it was a walk in the park, but it was like the year with a bad flu. By the time we get home on Sunday, we start giving you ivermectin for 8 days.
Which we should have taken with us to Greenville because
Yes.
we had planned on that.
Oh my gosh, this is something I've kicked myself over for a long time. Why did I not take that? And that was the emphasis for me to write that ebook called Kicking the Viral Load. Everybody should have their home pharmacy with them all the time. Wherever they go, they should have it stocked at home, and then they should have it with them when they go on the road, especially if you're immune compromised. It was ridiculous. So we were caught with our pants down, as the proverbial saying goes. We were late, and this is why you might be saying, well, you gave him ivermectin for 8 days. Well, we were late. Ivermectin, the research says that, you really should be giving it to people the first 5 days to try to avoid that really bad respiratory symptoms and avoid hospitalization. So we were late on that, unfortunately. I believe it did still help him, and even if you're late, you should take it. We eventually switched to HCQ after that. By Monday, I knew I was sick. All 3 of us are sick, my son, Lee, and I. Meanwhile, my daughter was completely fine. He went to go see the oncologist because we had called them on the Friday before. The other thing that I should say is Lee had mentioned to me on that trip, he said, I think it's time that we start talking about doing treatment for CLL. And I would agree, because if I measured Lee's neck on that trip, and I think the CLL combined with him being sick, his lymph nodes went crazy. And I think his neck was 3 times the size of what it normally was. It's no wonder he was having so much pain. When he went to the oncologist, that was one of the things that he discussed with them was, hey, I think it's time to start treatment. So she said, hey, we're going to do a CT scan. You're on the fence whether we should start it for you or not. But the CT scan will be a determinant for whether we start the oral chemotherapy. This section of the interview is called Pressure from Family. We went on our trip, came back on Sunday, and then that Wednesday, we get word from Lee's family, who we were staying with, that one of his family members tested positive for COVID that Wednesday. And then we get a phone call. Do you remember who we got a phone call from?
My brother, I know, called.
Yes. So he was one of them. And also your mom was calling because she wanted you to get a COVID test. That was a bone of contention for us, unfortunately, because we knew that 1, they're bogus, and 2, that they're under emergency use authorization. I won't go into exactly why, but we did not want to be tested. And quite frankly, we already knew he had COVID, so there was no point in getting tested, because it would not change the way we were going to treat him. Towards the end of the week, we also got a phone call from your brother. And do you remember what your brother was calling for?
To see if we got the vaccine.
And do you remember what you told your brother?
I'm sure most of it was about the research that, we had done on the vaccine, that it was not a safe thing for me, especially having cancer, and that we were not going to get it.
Yes. Well, that was the nice way of paraphrasing that. But I came in on the tail end of this conversation, and I heard him say to his brother, these things are evil. And they are from the pit of hell. Okay, now you got to remember we were in a crucible, a vacuum, and we were both sick. So, the filter was pretty low, but the conversation ended on a good note, which was good. But I was extremely proud of you for speaking the truth and for standing up for yourself, even when you're feeling so crappy. However, on the other hand, I will have to say that I was not happy that there was extra stress being put on both of us, but especially you at that point in time when you just needed to be healing up. It was just a difficult time. And I'm sure there are people out there that can relate to what we're saying. Families that should be supportive, that didn't feel supportive because of a lack of understanding. It just felt very conditional, even though I know that is not how it was meant to feel. It's just a difficult, very difficult time.
So Lee's brother called. I come downstairs and I'm wondering who he's talking to on the phone. And then it gets heated. Gosh, they're talking about the vaccine. Oh, I'm so mad right now. If he called to see how you were, how did you get on the conversation of vaccines? He's like, I don't know. That's the last thing you need to be doing is arguing with your brother. You could tell he was patient to a certain point, and then he finally was like, these things are evil. They are from the pit of hell. I have researched this extensively. Did you do any research? Well, yeah. And he goes, well, send it to me. I'd like to see it. And then he talked about VAERS. You didn't do any research if you don't know anything about VAERS. You are totally in the dark if you have no idea about that. Needless to say, I'm not happy. It ended well, but it was definitely a heated conversation. And I had just sent them that video with Peter McCullough where he basically says these vaccines aren't fit for human use. My sister-in-law texted me very recently and said they're mandating the jab. Can you recommend which one? No, they're all bad. Send in a religious exemption or quit your job. And she's like, oh my gosh, we are living in hell right now. Tells you all you need to know about whether you should take this vaccine or not. I mean, you have to be dense not to see what's happening right now. It was covert for a while. Now it's so overt, I don't understand. How can you not see it?
Now we're going to move on to the cytokine storm. Lee was sick for 2 weeks, and now we're fast forwarding. So we were at the beginning when we left, I believe, for Greenville. It was the 1st of October, and now we're at the 11th of October. Lee is worsening. He has a 101 degree temperature. He's got a migraine headache, poor appetite, congestion in his chest, now starting to have some issues with breathing. We decided we needed to go get a chest x-ray. So we scheduled a telehealth appointment because, of course, back then you didn't go in. The next day came and we had this telehealth visit with the PA, and the PA basically said, well, we can't do a x-ray until you get COVID tested. And if you test positive, we can't give you an x-ray. Oh my gosh.
That's going to work out well.
Oh, the insidiousness of that gets me every single time. I'm thinking, well, you got people in the hospital with COVID. Why can't you bring somebody in with COVID to get an x-ray? If your masks work, people, and the vaccines work, then what do you got to worry about? Yeah. Okay, that's a different story. About that. And then she said, and if he tests positive for COVID, then we'll do the monoclonal antibody treatment for him. In the meantime, she was gracious and gave us what we were asking for, which was antibiotics and inhaled or nebulized budesonide, which was great. We hopped in the car and went to the doctor's office and sat and waited in the car for somebody to come out. Yes, Lee was COVID tested. You want to talk about that little COVID test that you got, which we really didn't want to get you, but know that we were, under duress. Now we had to. I
think that was I got two. I'm not sure when the first one was, but if that was the first one, it was not fun. To stick that thing up into my brain and check out my cavity up there was very discomforting.
Yeah.
For sure.
So Lee got the brain feed one, not the one that they just swab your nostrils with, which there are other things that I have problems with about that in general. But of course it came back positive because they run those things at too high of rates. They're not supposed to tell you what you have. They're not supposed to diagnose anything. They're supposed to tell you how much you have of what you have. So anyway, I digress. It was positive. So now we're headed to go get the monoclonal antibodies treatment, which was going to be the next day, which was October 13th.
A great day.
Oh,
a day that'll live in infamy.
Yes, it will. Oh, this is what I was going to say about the monoclonal antibodies. Now, Lee never got this treatment, and we'll get to why that is. But I think that was God's saving grace, because come to find out that the treatment was also under EUA. It was also experimental. And at that point in time, they were giving 2 different types of monoclonal antibody infusions together. This treatment it issued its EUA on February 9th of 2021. And miraculously, almost 2 years later, in December of 2023, it was revoked and not renewed, which tells me it didn't work, or it was harming people, or both. And I would tell you, probably both. The human monoclonal antibodies were produced in the laboratory using a recombinant DNA technology. And one of the drugs specifically was genetically engineered antibody. Now, doesn't that sound like something you want to infuse into your sick body, or even a healthy one at that? No, probably not. Here's the kicker. They found, after they infused this in people who had COVID, that the clinical symptoms for SARS-CoV-2 worsened, meaning they had a fever, hypoxia is oxygen deficiency, respiratory distress, and sometimes events that required hospitalization. So this is going to make sense why he never got this treatment.
And I missed out on that.
Oh, gosh. Praise the Lord. All right, so now we're moving on. This segment of the story is called Getting Kidnapped. This is day 1 of the saga, the hospital saga, and it's 10/13. It's at noon that he has his monoclonal antibody appointment at the hospital, and it's an outpatient procedure. I pull up to where I'm supposed to pull up. I guess it was a nurse. I don't know who it was. It's some healthcare professional comes out to get Lee, and Lee is miserable. And honestly, I was at my wit's end. I was completely feeling helpless at this time because he was getting worse, and I was getting very concerned about him. But the nurse, I'll never forget it. The nurse pulls up. He opens the door. He has a wheelchair. Lee gets in, and he proceeds to mummify Lee. So do you remember what happened, Lee? All right, he's shaking his head no.
I was not feeling very good at that point.
Oh,
I remember, I
gosh.
think he asked, "Do you want to use the wheelchair?" And I'm like, "Yes."
Yes. So he sits down, but he puts a paper gown on him. He puts a mask on him. He puts a paper hat on his head, and then he puts a plastic shield over his face. Are you kidding me? This person is, first of all, feeling crappy and not breathing all that great. And now you're putting all this stuff on him. And then he proceeded to wheel him away. And honestly, I can still see it in my mind's eye. And I remember thinking, I just don't feel good about this.
I need some help. I need your prayers. He is not getting better. I'm really concerned. I just dropped him off at the hospital to get his infusion. No one else to do anymore. He needs to turn around in the next 24 hours. Sweet Jesus. I'm so frustrated right now.
30 minutes later, I get a phone call from Lee.
Okay, so I just got a phone call from Lee. He said that his oxygen saturation was 85, which is definitely low, and that they are sending him to the emergency room and aren't giving him the treatment. So I said, hand the phone over to the person that just told you that. They're like, well, all his vitals except for his O2 is off, and you're not going to give him the treatment that he needs, and it's probably the very reason why his O2 is off. We can't, because we're not allowed to with his oxidation stats being so low. We have to have a physician's order in order to give him the treatment. So this is how they get them in the hospital. And then they get them to get admitted. And then they kill them. Need some prayer. It's getting real fast.
Do you remember what happened after he wheeled you away from me?
Yeah, I remember they checked me in and wheeled me into this room. There was about 2 or 3 people in beds, waiting to get this antibody treatment, So I remember that. So the first thing they did was lay me down and put the oxygen meter, what's that thing called?
Pulse ox.
The pulse ox meter on. And he goes, "Oh, we can't do this because your oxygen is too low. And at that point, I had never thought about my oxygen level in my entire life, I don't think. So he's like, it's in the 80s. We can't do that. And 80s is pretty bad. So no wonder I was feeling so bad. And so he was like, well, let me check on that, because I think they were going to try and see if they could do it, but they were like, you're too low. And then obviously somebody else saw the reading and said, we got to get him to the ER.
I get a phone call from Lee at that point in time, and 30 minutes later, and I thought, okay, this isn't good if Lee's calling me. He said, the nurse is saying that my pulse ox is 85 and that they can't give me the infusion because it's so low, so we're going to the emergency room. And I said, okay, you hand the phone to this person, hand it to him, because I was like, I have some questions. And of course, he hands the phone to this nurse, and I'm talking to him, and I say, and he confirms what Lee is telling me. I say, okay, so you're bringing him to the emergency room. Am I going to be able to see him? And he said, yes. And I said, so I will be able to get in and see him. Yeah. And I'm like, okay. So I immediately pull around. I go to the emergency room, go in through the doors. Now, you have to know, I was working for this hospital, so I knew this hospital very well. Went to the person that said, hey, of course, my husband's back there. I'd like to see him. And so she checks and she goes, you can't see him. And I said, why not? And she's like, because he has COVID. And I said, no, you need to bring me back there. And it ensued this conversation that did not go well, because it obviously began to escalate, especially since I was informing her that I was told I would be able to go back and see him. I basically said, you either bring me back. This is the gist of the end of it. I said, you either bring me back there or you bring him out here. Either way, you choose. And she's like, no, he's getting treatment back there. And I said, I don't think he is. By this point in the conversation, I was actually losing it. I was yelling at this individual. Not my best moment, but she was getting the full brunt of Dr. Toe. So I called him. I said, hey, are you getting treatment? And Lee's like, no, I'm just sitting here. And I was like...
Was that once I'd been taken to the ER?
Yeah, you were in the back room.
In the room.
And at this point, I'm hysterical. Okay, you got to remember that we are both sick. I said, you bring him out here right now. And she was like, no, he's going to get treatment. You have to leave. And I said, look, I am his wife. I live with him. And then she connected the two of, oh my gosh, she's probably contagious. And she's like, you must leave. I'm not going anywhere. Well, I'm going to call the police. And I said, you know what? You go ahead and do that. Call the police, because you've just kidnapped my husband. Of course, the hospital police show up, and there's two of them. You've got to leave. You've got to leave. And I'm like, I hope my words burn in their brain, because what I told them, I was yelling at them and they were escorting me out. Yes, I almost got arrested. I basically said, what you are doing is wrong, and you know it's wrong, and you have just kidnapped my husband. If he doesn't start to get treatment that he needs, I will be back here and you will roll him out to me. And if you don't, I will call the sheriff. And that's where we left it. And I walked out and I sat on a bench just outside the emergency room doors and stewed. I was so mad. That's the story of getting kidnapped. And here we come to it. So what? So what, Dr. Toe? Well, the so what is, you must always stand vigilant over your family, over your life, over anything that matters to you. You must stand watch, and you must protect. And when all else fails, your supports are all gone, you must lean on the Lord. The Lord is your hope. He is your rock. And if you do not know him, I encourage you to put your trust in him today. And if you do know him, you need to lean on him in these very dark and difficult seasons of life. Psalm 121 says, I will lift up my eyes to the mountains. From where shall my help come? My help comes from the Lord, who made heaven and earth. He will not allow your foot to slip. He who keeps you will not slumber. Behold, he who keeps Israel will never slumber nor sleep. The Lord is your keeper. The Lord is your shade on your right hand. The sun will not smite you by day, nor the moon by night. The Lord will protect you from all evil. He will keep your soul. The Lord will guard your going out and your coming in from this time forth and forever. Well, that's a wrap. If you like what you heard, please share. Want to hear more? Please subscribe. And if you're a faithful listener, thank you for all your love and support, because without you, I would not be here. I'm glad you're along on this journey with me. We have each other, and we are not alone. Tune in next time for part 2 of the hospital ovens and patient prisoners. Pursue health, live free, and breathe deep. Until next time, everybody, this is Dr. Toe signing off. Important disclaimer. This podcast is presented solely for educational and entertainment purposes. I am not a medical doctor, and I do not diagnose, advise, or treat. This podcast is not intended for the substitute of advice from a personal physician, professional coach, psychotherapist, or other qualified professional. It is not intended to be used or relied upon for any diagnostic or treatment purposes, or to be used as a substitute for professional diagnosis, treatment, or conventional medical therapy. None of the statements made in this podcast have been evaluated by the Food and Drug Administration. Please consult your healthcare provider before making any healthcare decisions or for guidance about specific medical conditions. Listen responsibly.